Well, I think because when you've just given birth, you'll be seeing the midwife and they will be looking at you and, they can sort of tell you if your pelvic floor is contracting. I would think waiting a few weeks, because in general, some people will just get better. It will as the healing because you've got a lot of swelling, depends if you've had stitches. But if it is you, then talk to the healthcare professional that you're seeing, whether that's the GP, the midwife, or the practice nurse or somebody like that. But never, ever think it's normal. If you're leaking, you need to do something about it. And it maybe it's just a way of, if that's you, you must do some pelvic floor rehabilitation. Everyone should, and everyone doesn't.
I'm Shreya Parekh, and this is Empower Her, the podcast for women over 35 who want to take control of their health and wealth. Join me and my guests as we share insights, resources, and ideas to help you break free, learn more about yourself, and live your best life while closing the gender gaps. Hit follow to stay connected and sign up for free emails on the Empower Her website to supercharge your journey. How much do you really know about your pelvic floor? It's a topic often avoided, yet so many women experience issues like leaking at some point in their lives. Let's break the silence. Join me for a fascinating conversation with Jane Simpson, a pelvic health expert with decades of experience. A former Continence Nurse Specialist and author of the Pelvic Floor Bible, Jane has been featured in The Times, Radio 4's Woman's Hour, Channel 5 News, and many popular magazines. She'll share her insights on everything from stress incontinence to pregnancy, menopause, and more. Tune in for expert advice on improving your pelvic health. Jane, welcome to the Empower Her podcast. It's great to have you on. I'm really looking forward to talking about the pelvic floor because it's a topic that isn't talked about much, and a lot of women do suffer in silence, and there is a bit of a taboo around this topic as well. So please, could you introduce yourself and talk a little bit about your journey from what you were doing to what you're doing now? That would be great. Thank you so much.
It's my pleasure. It's lovely to be here with you today. So my background briefly is I trained as a nurse at Addenbrooke's Hospital in Cambridge, and I went on to become a district nurse. And I found that, incontinence was a terrible burden to people, and really there wasn't a lot of help. It was just wearing pads. And I was at the beginning of nurse specialism. So I became a specialist nurse as a Continence Nurse Specialist. And then I started a private practice in 1996 in the London Clinic in Harley Street, where I worked for 26 years, looking after pelvic floor health. And that included men and women, largely women, because women have more problems than men do. Men tend to be post-prostatectomy, radical prostatectomy for cancer. I mean, there are other reasons too, but it's more women, particularly from childbirth and the menopause. Those are the two main reasons why women suffer. And we will no doubt talk about the different types of problems that you have. And I looked after all of them, from stress incontinence, which is when you sneeze and you leak and you wake yourself. I'm sure all of us have had incidences of that. The overactive bladder, which is when you put your key in your door and you think, oh my God, I'm never going to make it to the toilet in time. Prolapse, that heavy feeling, problems with intercourse, and pelvic floor dysfunction, cystitis, and constipation. So there's a huge variety of things that I looked after. And then last year I retired from clinical practice, and it's great. It means I've got more time to do these kind of things, because before I just was so busy working, seeing patients every day. And the other thing I did was, and I'm going to show it on your film, is I wrote the Pelvic Floor Bible. So this book was written 5 years ago, published by Penguin. See a little penguin there. And it covers all of the things we'll talk about today. And you can buy it on Amazon or in a bookshop, and you can get it in the library. So I think that's important that everyone has access to it. And that's kind of my history, really, my little journey through 42 years of being a nurse, and I can promise you that I've loved every single day of it. It's been a fantastic career, great privilege to care for the sick, I always think, and I've had
Yeah.
42 lovely years of doing that.
That's fantastic. Obviously, you have ample experience in this subject. So I just want to kind of go back to the basics of what is the pelvic floor, because you often think, oh, I'm leaking and I have these symptoms, those symptoms, but the basics of the pelvic floor, what is that?
So I think to try and make it in an understandable way that we can all relate to is, if you think of your pelvic floor, and a lot of us are now doing yoga and Pilates and strengthening things, is to think of it as the bottom of your core. So if you think of your front lower abdominal muscles and your lower back muscles, and then you've got your diaphragm at the top, your pelvic floor is at the bottom. And if you think of it at the bottom of your pelvis, I mean, really, if you didn't have a pelvic floor, your internal organs would just drop out. It's a hammock coming from your tailbone at the back to the pubic bone at the front. And it is just like a bouncy hammock, or a trampoline is a good way to describe it. But it also goes side to side. So if you think of the bones we sit on, as you can sit side to side, those sort of sit bones that we have, your pelvic floor is doing that. And coming through it is your anus, your vagina, and the opening for your bladder. So it looks after a lot of very important organs, and it's a very clever muscle because it's able to contract, to stop us passing wind in public places. We can know when we want to do a poo. We can say, oh yes, I can hang on till I get home. We can contract our pelvic floor and control it. The vaginal muscles we can use for intercourse. We know how to contract them and relax them. And we can also stop our flow of pee mid-flow sometimes. And if you can't, then you've clearly got pelvic floor dysfunction. So if you think about it like that, as just a hammock at the bottom of your core, and it's such an important muscle, long forgotten, it's tucked away in our knickers. And so because it's tucked away in our knickers, we just don't think about it, do we? We just sort of, oh, it'll be fine, it'll be okay. It's normal to do a bit of pee when you sneeze. Well, it jolly well isn't. And hopefully at the end of this, we'll have inspired everyone to do something about it.
Yeah, that's the thing, having the view of these things are normal when they clearly aren't normal. I will admit very openly now, I have issues with this, and I actually thought it was a normal thing many years ago.
You do. And if I go into the supermarket and I look at people putting sanitary towels into their trolley who are clearly over the age of 52 or 51 or whatever the average age of the menopause is, they are putting them there because they're leaking. And so we've got so used to, as women, wearing sanitary towels, tampons, all the rest of it, that we can just think, oh, well, if I'm going to play tennis, I'll wear a panty liner, or you give up playing tennis, or whatever it is. I've had so many patients come to me who've said, well, I was going to, run the marathon, but, I can't possibly even consider it because I can't, I'd be soaking wet by the end. And it's most of the time, it's a very curable problem. I mean, there is a few cases where, surgery is required, but they are like way over here. 90% of us can cure stress incontinence and the overactive bladder too. So, and quite often we have a bit of both. So we are maybe suddenly seeing the front door and thinking, my God, I'm crossing my legs because I'm desperate for a pee, and you can start to think it's going to come. Then if you were to sneeze, you would just lose the cloth altogether and you would be leaking. And so quite often you have a bit of this overactivity of the bladder. The bladder starts to squeeze and then you have no pelvic floor control. So you're going to leak as well. So, it's important for quite a lot of things, not just when you sneeze, cough, laugh, jump. How many women who are listening to this dare get on their child's trampoline? Because I can bet you it's a lot of people who will say never. Or grannies who are listening to this, because my next door neighbour's got one of those huge trampolines in her garden, and I've never seen her on it. I shouldn't say that about my poor next door, because I don't know, but I've never seen her on that trampoline. Her grandchildren get them jumping on it, but not her. And I think we all sort of, just because we can actually do things to avoid trouble that aren't that difficult, are they? So, oh, well, I'm not going to get on the trampoline, or I won't play tennis, or I won't do X, you know.
Yeah.
But that's a shame, because we can enjoy those things. We don't have to live like that.
Yeah, absolutely not. So why do women experience pelvic floor issues? And as you said, it's not normal. It absolutely is not normal.
It's not.
And then obviously the things that can be done about it as well.
Okay, so you know, the two main causes of pelvic floor dysfunction are having a baby and the menopause. Having a baby, you know, so if we have children over the age of 35, we have more than 3 children, we have big babies, and we are tending to have babies later, have bigger babies, end up with, as a result, instrumental deliveries with forceps or 1-2s, because the baby's bigger. We haven't evolved bigger, we're just having bigger babies. And, you know, those are the times when pelvic floor trauma happens. You have big episiotomy for a forceps delivery, but just having babies later and that make a difference. Other things that affect it are being very overweight, because if you think about it, you know, it's like being pregnant. If you're very overweight, that's all bearing down on this bottom of your little core. So being obese is an issue, and there is more obesity around these days. Things like constipation. There's a huge relationship between bowel dysfunction and pelvic floor dysfunction. And we know that 50% of people who have chronic constipation have pelvic floor dysfunction. But you wouldn't think straining to have a poo was causing you to leak urine, but actually it can affect that. And certainly also with things like prolapse, pushing and straining is an issue. So those are the main reasons really why you would have it. I mean, it could be caused by trauma, or and there are other things that affect the pelvic floor, not just leaking when you sneeze and things like that, but some people have an over tense pelvic floor, and that can be caused from, you know, trauma as younger, from sexual abuse. Just sort of having a bad relationship, and therefore then finding intercourse very painful, or finding that you're tightening up the pelvic floor all the time and you're sitting there with your pelvic floor muscles tightened, you struggle to relax, so you have pain, and those kind of issues. And then the second one, as we said, was menopause. It's the big one. When your hormone levels start to drop, you can suffer a lot with pelvic floor dysfunction, when you really thought you were just about hanging on in there, getting to the front door, because quite often it's the urgency and frequency of peeing that is at that time. And you're thinking, oh my goodness, I was just about making it to the toilet, but now I can't make it to the toilet.
Yeah.
It's largely due to drop of estrogen in the body. And I'm a huge fan of vaginal estrogen, which is an extraordinarily underused thing. It's applied locally into the vagina. It only affects the vaginal muscle. It's not absorbed by the rest of the body. It's very safe to use, and it really, really helps with postmenopause, with that feeling of urgency. UTIs as well, it can help, you know, get rid of urinary tract infections, and also for your sex life. People I've met lots who've given up having intercourse, penetrative intercourse, because it just was too painful. And I'm hoping that some people who are listening who are having these issues are thinking, gosh, that's me. Or they are having intercourse like very rarely, because that's saving their relationship, if you like, because the poor partner doesn't want to hurt them, but can't understand, you know, maybe they don't want him anymore. So that it's a whole myriad of problems, and all related to lack of estrogen in the vagina, where using vaginal estrogen can really make an enormous step change and reverse those problems. So those are the reasons why you would have pelvic floor dysfunction. What you do about them varies. And I think if we think about the most important things to do with the pelvic floor is, are you using the right muscles? Because if you're not, you know, I've seen so many patients because of course I would examine every patient, then I could feel the pelvic floor. And I actually had a computer, so we would insert a vaginal electrode, connect to the computer, and then you could actually see your pelvic floor on a graph. So you could actually see how you were doing. So you could contract, make a little nice curve and relax and see how long you could hold it for. And that biofeedback element is hugely important, because we all like that. It's like when I smile at you, you're smiling back. We are, as humans, we need that kind of element of feedback. And it's the same with pelvic floor. And loads of patients will say, oh God, I've been doing my pelvic floor exercises, but I'm so bored. I keep forgetting. I can't remember to do them, or haven't done them for weeks. I know I need to do them, and things like that. So by actually having some kind of feedback, and whether that is a simple thing like inserting a tampon and squeezing it and trying to pull on the string to see if you can hold it in, or it just comes out and you have no power to contract around it, or just inserting your finger into your vagina and trying to contract around it, to just get the idea that you're using the right muscles, because using the right muscles is the most important thing. And the second thing is doing the exercises often enough. And if you can't, and you're just, I can't do the exercise, I just can't, there's now loads of gadgets out there that can help you to remember to do it, or just give you some help in doing it. I think the first one to mention is probably the Squeezy app. Which is a great app that was designed by some physiotherapists who are fantastic, and you can set it to beep at you. My niece has an app for her periods. I was always terrified when it would come. I had no idea. I don't have them anymore, thank goodness. But at the time you were thinking, oh my God, is it this week? And you'd always have these tampons lurking about in a hammer. Now the young, they map it on an app. And pelvic floor, we can do the same. Luckily for us in this generation, technology has moved on, allowing me to talk to you like this. So the Squeezy app's good because it beeps at you and tells you. It doesn't, however, give you any physical feedback on how, if you're using the right muscles. So you might be doing the exercises, but you may not be using the right muscles. So I always think one trip to someone like me or a pelvic health physio is never a bad thing. Or even when you go to the smear test at the surgery, ask the nurse, can you just check my pelvic floor muscles? Are they working? How do I contract?
Okay, yeah.
I just think, why not? And I actually gave a lecture about a month ago in Hammersmith to 300 practice nurses. And I said to them, you are the sharp end of this, because I am over there somewhere. Somebody's got to get referred and then find someone to go to. And it's all, bottom of the to-do list, because actually getting the kids to school on time or looking after granny is more important, or doing both. So having, the practice nurses, I said to them all, I said, look, every time you do a smear test, because you are seeing ladies just who are coming in for the smear test, check their pelvic floors. Do they have a bit of prolapse? Can they make a contraction? And so I'm hoping that is a good way. And if everybody who's listening in next time they go for a smear test just says, look, can you just see if my pelvic floor looks all right? Has it got enough estrogen if you're in the perimenopause or the menopause? Or if you've had a baby, sometimes if you're breastfeeding, you have lack of estrogen in the vagina. So there are lots of things that you can do to try and find out if your muscles are working. And if you are unsure, or when you do insert your finger and you think, well, I can't feel anything, nothing's happening, or you can try contracting around your partner's penis or your husband's penis if you're having sex, and think, oh, I'm not sure there's much happening there, or actually this, oh yes, I've got it, I understand. And if you really can't feel it, then that's when you should take action and go and see somebody. So following on from the Squeezy app, we can use vaginal weights. So women who have not terribly bad pelvic floor, maybe a bit of stress incontinence, very busy lives, I've always rather liked vaginal weights. Again, it's a feedback. It looks like a tampon with a string. You pop it, and they come in weights, so they're just very light weights going up. So you start with a light one, pop it in when you're in the shower, just for 10 minutes. By the time you come out of the shower, take it out. Don't forget, I've had lots of ladies who gone on the tube and thought, oh, whoops, I've got this thing. And then of course as it starts to descend, so because the muscles get tired, anyway, that's another story. But as you get better at it, you can hold heavier weights. So it's a feedback to you that you're improving. The biggest feedback is, are you still leaking when you sneeze and cough? Or, is that going to the front door? Is it easier? You can get the key in time. Mm-hmm. But they're useful for a group of women. It's no good if you've got a prolapse of any kind. You need to just have a little bit of stress incontinence, a little bit of overactive bladder or something like that. But they have a place, I think, in the armory of things to do with helping the pelvic floor. Then there's a group of products which are, so biofeedback things. So there's something called the LV trainer. It's an expensive piece of kit. You pop it in the vagina, you have an app on your phone, and when you contract the pelvic floor, you can actually see little graphs, and it monitors your progress with a pie chart. So you can actually see, yes, I've used it 5 times and, I'm getting a bit better. And again, that feedback. And there are various ones of those available now on the market. If your muscles are just not working at all, then using electrical stimulation is helpful. Mm-hmm. It does have certain contraindications, and I would definitely, if you feel you can't contract your pelvic floor, you need to go and see someone, and then they can give you the right piece of equipment. But I used electrical stimulation quite a lot with my clients, and I really found it helpful. And they would say to me, oh my God, I'd forgotten that's what it feels like to be able to contract the pelvic floor. So there are, starting off with Squeezy Out, which is doing it yourself. It is easy, going through vaginal weights and biofeedback pieces of equipment and electrical stimulation. And then, maybe going for some sessions with someone like me, because sometimes that's what you need. We all go off to the hairdresser, don't we? And we go to the dentist, and we go to the, chiropodist, or we go to Pilates or yoga. We pay for all these sessions. But when it comes to our pelvic floor, and it's such an important part of our well-being. If you're worried that you're going to leak, or for example, lots of my patients refuse to go to the cinema or the theatre because they were terrified of being in the middle of the road and not being able to get out. Mm-hmm. So you're actually stopping doing the things that you love in life simply because of this problem. So those are sort of strengthening for the pelvic floor. If we're talking about overactive bladder, we can use a sort of way of training ourselves. So if you think about how often you're going to the loo, has it become literally you're going every hour just because you're worried and you've stopped drinking, or you're drinking too much coffee or tea, and certainly physics. So you can actually do a bladder diary. Have a look at what you're consuming, and that's at least 5 macchiatos a day. That could be a problem, because we know that caffeine affects the bladder, and fizzy drinks particularly. So if you actually just for 3 days look at what went in and what came out, you can really self-help. You can actually really help yourself by doing that. And actually the Squeezy app has a sort of bladder diary, as does my book, so you can work out how to do that for yourself. And then if we move on and go a bit more nuclear on it, you can, there are drugs you can take from the doctor. They're not over the counter, they have to be prescribed by the GP. There are sort of electrical stimulation things in the ankle that can help you, and there's surgery that can help you. But those are really like over here. And a lot of the overactive bladder issues can be really helped and cured. And in a younger population who've never had kids, who have maybe a tight pelvic floor, they tend to have these issues. And so by trying to get them to relax pelvic floor muscles, which is really the reverse of that pulling in, we haven't sort of discussed how you do a pelvic floor contraction, which we will do in a bit, but it's like as though you were trying to push down, as though you're trying to have a poo almost, just a bearing down to try to relax the pelvic floor. So those sort of things are quite important, and that's a massively quick run through of ways to look after pelvic floor health and the overactivity of the bladder.
Yeah, you mentioned too much caffeine and fizzy drinks. How does that affect bladder issues? Because I know some people rely on caffeine and perhaps fizzy drinks. Like, I mean, what's the is it 1 cup, 2 cups, 3, 5, 10?
So if you were talking to a purist, they'd probably tell you, cut out all coffee and tea and fizzy drinks. And I've never been like that. And alcohol, I mean, I think that's a tragedy. I mean, and I don't think you get compliance if you say to people, you're not allowed to do any of this. That's just rubbish. So I think in moderation, so I couldn't live without my morning cup of tea. I would just be very sad. Yeah. So I think if you just have like 1 or 2 a day, it's when you look at people's fluid intake and you see that actually they are having 5 coffees a day, or they're having, loads of Perrier water, and they've taken to, drinking fizzy things. I had a patient came to me who had tried to give up drink. Well, they weren't giving up alcohol altogether, but they realized they were drinking a bit too much alcohol. So they were sort of having Perrier water, which looked like a gin and tonic, if you know what I mean, at a party. They sort of have Perrier with lemon in it to look at like, oh yes, I've got a gin and tonic, and actually it wasn't. And it was that was doing it. I said, well, it's extraordinary how just taking up drinking this fizzy drink had caused that to happen. Now, the only way you can find out is to experiment with it. So instead of having 5 coffees, have 2 and see if it makes any difference. And if it doesn't, I think you just go back to what you were doing. I'm not telling anyone to stop drinking tea, coffee and fizzy drinks. I'm just saying that they may make it worse, and it's worth for a day or 2 just having a trial without and see how you go. I've never been a brutal person about this, because I actually think then, as I said to you, you won't get compliance. People might do it for a day or 2 and then they'll think, oh, blow it, I need my coffee, I've got to go. But if you know, and lots of my patients would say to me, and chocolate can sometimes do it too, lots of my patients would say to me, look, I've just had to have that macchiato and I will bear the consequences of running to the loo 4 times afterwards. But at least then, if you have self-awareness of what's actually causing the trouble, you can then live with that. Whereas when you're out of control, you've no idea why it's happening to you. But once you've tracked it down to it's this and this, or it literally is because you're in the middle of the row at the cinema, and that causes your adrenaline, it causes you to be so anxious that you can't, you're desperate for a pee 10 minutes after the film starts. So whereas if you'd been on the end of the row, you'd have been fine. So you can manage those issues as well as dealing with them by looking at fluid intake and maybe vaginal estrogen, things like that. So I think those are quite important to just bear in mind. And the bladder diary is brilliant because it really shows you what you're up to. I mean, all of us looking at what we've been eating and things like that, but that is quite helpful. And did you go for a pee 4 times in the day or 24 times? We should go about 5 to 7 times a day. Once in the night is acceptable. If you're going 4 times at night, it's not normal. So you can then actually look at yourself, and it's just something we never have time to do. But now we all have Apple iPhones or mobile phones, with apps and whatnot. We can monitor ourselves more easily. Before you had to have a piece of paper, writing it all down in little rows. Now we can have spreadsheets or apps or whatnot, which does make it easier to do. It's more user friendly, isn't it?
Absolutely. I want to talk a little bit about the symptoms. Now, I know perhaps the symptoms and the issues you might have will be different when, I don't know if it can be during pregnancy, after pregnancy, and then you've got perimenopause and then postmenopause. Are the symptoms for each of those stages different, and what are those symptoms that various women can come across, and at what point should we be seeking help? It sounds like to me if you are leaking, you should be seeking help straight away, really.
I think so, and now that there's a bit of a push on trying to let all women, so up until relatively recently, when you had a baby, 6 weeks later, the only person that got to check up at the doctor was the baby. And there you were, sort of struggling on. And there is now money has been put in by the government to GPs so that the person who's had the baby, the mother of the baby, is getting looked at too. Now, whether that's your mental health, with your breastfeeding properly. The other thing is the diastasis recti, which, for those that don't know what that is, it's a division of the rectus sheath. So just below your belly button, if you can feel a gap there, that happens sometimes when you have babies, and in general it closes up again. But it is part of your core, and if that's open, you need to know about it and know what to do about it. And there's simple exercises that you can do for diastasis recti. And also have a look at your, the GP's checking, are the stitches healed? If you had stitches, does everything look normal? Is there vaginal dryness? And so, for those of us who are trying to recommence our sex lives, having had a baby, when, it's a difficult time, you've got a new baby, your body image has changed, and then it's jolly painful when you do try, your partner or husband who's just seen you go through having a baby and watch the trauma of it isn't going to do it again if it caused pain. It's a very important thing that we are looked at. And the symptoms that you get could be at that time postnatally: pain, vaginal dryness, leaking, inappropriate passing of wind, farting in without even being able to have any awareness of it at all. And all of those things, should, as your hormones start to rise again, once doctors in the past would say, oh, well, when you finish breastfeeding, you'll be fine. Because then your estrogen levels and your periods come back and your cycle is renewed. But it's a vulnerable time for women, and it's a time when hopefully you are seen. There's now a lot of clinics being set up called mummy MOTs and things like that. And I think that's the best present you can give to your daughter or your daughter-in-law or a friend, is a mummy MOT, because you go along, you have your pelvic floor looked at, you have your abdominal muscles looked at, they talk to you about breastfeeding and all of those things, and how you're coping with life afterwards. And if the GP isn't able to do that, then at least there are now people starting to do that. And I think that's a great present to give that. And in fact, I used to give that gift to my friends' daughters. I don't have any daughters, but in my friends' daughters, I would say to them when they've had their children, and they used to come, and I would give them a mummy MOT. That would be my gift to them. And I think it's a better gift than a romper suit or a bunch of flowers from me, because that's what I could do for them. And they all really appreciated it. So if you have that available to you, that is very helpful. And I think, we'll just put the pad on and leak and think, well, hopefully it'll go away with time, and everybody else is having that problem. And actually, it might not. Some of your friends, it will get better once your periods come back and you're back into the swing of things, and you've lost the baby weight and you're back to the gym or back to doing whatever it is you do, you're fine. But, prolapse, so a heaviness, which is another very important thing and can happen postnatally. And I've seen quite a few women who were desperate to get their bodies back after giving birth, went back to the gym with some, Adonis 25-year-old bloke who had no idea where his pelvic floor was, having them jumping on a trampoline, a little trampette thing, and this poor woman came, she said, oh my God, and floods of tears, had caused prolapse because she was only 4 weeks postnatal, but she was so keen to kind of get back to normal that she was doing that. Or jogging, I've had them jogging too soon. Let your body recover. It takes a year to make a baby and a year to recover. If you do that, you'll allow your body to heal in all areas, including your pelvic floor.
Yeah, I think there's a lot of, issues around that. I'm not going to go into it now because that's a whole different conversation in terms of body image and, you know, seeing celebrities and people in the public eye have a baby, and then they've, you know, all of a sudden they look completely how they used to, or even more slimmer and more whatever. And then, you know, a lot of women look at that and think, how did they snap back into their body shape, or even a better body shape? I can do that too. And
we're all gorgeous, and we just need to recover our own speed. And unfortunately, the wonderful thing of apps and things like that also brings this kind of body images which are not the normal. You know, we don't not most of us don't look like that, and that's
exactly
we don't want to be like, but it unfortunately it does affect us. But I think prolapse is quite important because it doesn't really give you any symptoms of leakages or rushing to the loo or any of those sorts of things, but you have this heavy feeling in the vagina, particularly at the end of the day. So those of you who've either had a baby or have got to the perimenopause, who are, when you've been standing quite a long time, you think, oof, I feel a heaviness, like maybe I'm sitting on an egg, or there's a sort of bulging feeling below, or yes, quite a lot. So prolapse comes in 3 types. So there's one at the front, which is a bladder prolapse called a cystocele. Then one at the back called a rectocele, which is the bowel pushing into the vagina. It's basically, you think of the vaginal walls as elastic. If the elastic is weak, then when your bowel is full, when your rectum is full, you get a bulging of the rectum into the vagina. And I've had many, many patients who are having to insert 2 fingers into their vagina to push the poo back so that they can actually evacuate it out of their bottom, because it's caused this bulge, and it's like it's like a pocket. You can't, it's not going to go out of your bottom. And people are living like that totally unnecessarily. And the other one is when the uterus, the cervix, comes down, and you feel, possibly when you have intercourse, you feel, or you try to use a tampon, it turns around and comes back out again. You feel like it's painful. You know, I mean, smear tests are not the most they're pretty, well, not painful, but they're not the most pleasant thing. The cervix, you know, it has sensitivity, and if it's come down when you have intercourse, it's sort of, the penis bashes against it. It's painful. And so women put a pillow under their bottom so that it is like gravity, you know, you can't stand on it to all day. But prolapse is one of those things, again, that is very underreported, because maybe you're not leaking or having issues of running to the loo, but you've got this awful heavy feeling. And there are lots of things you can do about that, which is doing your pelvic floor exercise, which was going to help. But there are lots of pessaries now, really good pessaries. In the past, they looked a bit like a decoit. They were a round white thing. They were terrifying. And I've inserted lots of them, you know, from years ago. And you sort of squeeze them into a sort of oblong shape to insert them, and then they would sort of fly out of your hand. A horrible thing. But now they're not. They're soft and silicone, and they're easy to insert, and you can take them in and out yourself. And you can wear them while you're getting better. Or, for example, if your prolapse is very bad, but you want more children, you can use them until you finish your family, and then you can have surgery. If your prolapse is severe, you can have surgical correction. We, again, there was the issue of all this mesh that's been in the press and has put a lot of people off having prolapse surgery. And that's when pessaries, which I think are a great option. I think if I had a prolapse, I might use a pessary rather than having surgery, and keep doing my pelvic floor rehabilitation. They are great bits of kit, and there's lots of clinics around the country now that fit pessaries. There's a lot in London. So if you are in London, you can find a pessary clinic, but they are all over the country. There's actually, if you Google it, there's a map that shows you where they are. So I'm kind of a fan of pessaries. They have a great thing. And back to sort of running. So if you want to carry on doing things while you're doing your pelvic floor rehabilitation, using a large tampon in the vagina when you're running can stop leakages, because basically what you're doing is you're applying a little bit of pressure to the urethra. So that bit of pressure from the tampon is enough to stop the urine trickling out, because only a bit of wee, even though you feel like you're a bit damp, it's only a small amount. It's not the whole bladder's been released when you're running. It's little tiny dots. And so by giving that pressure in the vagina, some people use a moon cup, but there's been controversy about using that for this thing. And also, if you're perimenopausal, you need to be careful using tampons because they're very drying if your vagina's already dry.
Right.
But there are actually other things that you can get from the GP or you can get online. They're like spongy tampons that you wet, and you put them in and they expand so that they're applying the pressure too. So the tampon is, I would use it to see, does it work, before buying things online that you can use instead, or go and see somebody really to have one properly fit, which size would be the best one for you.
Yeah,
they're helpful.
Oh, that's very useful information. I had no idea using a tampon could help with.
Try it. It really does. If you're in the gym or jogging, it just gives a tiny bit of pressure to the front wall of the vagina, and therefore the urethra. I mean, so the urethra's a tiny thin tube, it's only about this long, and if you can just close it off, if you like, by using a tampon or something like that, it's very helpful. And it means that you can carry on doing your exercise, which is all helps your fitness, helps your core, helps you, but never forget to look after your pelvic floor at the same time.
Yeah. So I just wanted to clarify with pregnancy. So after you give birth, whether it's a cesarean or through the vagina, if you're leaking for whatever reason, is that abnormal? And
it is abnormal, yes, it is abnormal.
As in, like, if you're leaking straight away, or if you are leaking, do you have to kind of give a time frame of kind of you should really wait 2-3 months, and if you're still leaking, then there could be a problem? Or is it almost straight away? If you're leaking straight away after you've given birth, that's still not normal?
Well, I think because when you've just given birth, you'll be seeing the midwife and they will be looking at you, and they can sort of tell you if your pelvic floor is contracting. I would think waiting a few weeks, because in general, some people will just get better. It will as the healing because you've got a lot of swelling. Depends if you've had stitches. It's a very difficult question to answer in a way, because it's very personal to each individual, which is why I say, if it is you, then talk to the healthcare professional that you're seeing, whether that's the GP, the midwife, because in those very early days it will be a midwife, and then possibly the GP or the practice nurse or somebody like that. But never ever think it's normal. If you're leaking, you need to do something about it, and it maybe it's just a way of if that's you must do some pelvic floor rehabilitation. Everyone should, and everyone doesn't. But if that is you, that is a big trigger to say, yes, I'm one of the people that must really take myself in hand, and it really does work. So it's interesting, because over my career, I looked after, at the beginning, when I was about 35, all my patients were 55. And when I got to 55, a lot of my patients were 35. So we are getting better at being more open and talking about it and doing things about it. And lots of people came with their babies in prams, which never happened to me in the 90s. It just didn't. I hardly ever, if at all. So we are being more vocal and talking about it. And probably you give yourself that 6 weeks until you go for the checkup, and hopefully the leaking will have stopped by then. And if it hasn't, then that is a red flag at that point, that you need to really think carefully and see somebody about it. But in those initial days, just gently do pelvic floor exercises when you can. And, and if you can't, don't worry about it. Your body will heal. As I say, it takes a year to make a baby, and it will recover. So don't panic in those first 6 weeks. But don't wait 6 months either until you go and seek help. The problem is, if you've got a toddler and a new baby, it is low on your to-do list, I have to say.
Yeah.
And it shouldn't be, because it actually affects our quality of life quite a lot. And I think we need to be kinder to ourselves as women. And I think we are, we're in that sandwich generation where we've got all these little tots to look after. We're all working. In my mother's generation, women were at home. They had more time to care for themselves. We now have to care for the children. We have to work. We have to look after all the oldies as well. Which we're doing now. 2 old, very, very old dears. We're looking after 2 very elderly ladies who are adorable, but very old. And so we come always bottom of list. And I think if we can be kinder to ourselves, that would be my message to certainly postnatal women, is just because if you've looked after yourself and your pelvic floor is part of that, then you are more able to cope with life, with babies, with work, with everything else. So don't leave your pelvic floor for 6 months. That's my
Absolutely. Something I actually did, which I'm regretting.
There you are.
That's a difference. That's a different.
Well, at least you're admitting it, and it's never ever too late.
Exactly.
I've been asked so many times on these kind of podcasts that is there a point where it's too late for me to do anything about my pelvic floor? Never too late. I've had ladies in their 80s who, one in particular, who was doing she was collecting for the lifeboat, in one of those little boxes, and she'd done it for 40 years every year, and she just felt that she couldn't get to the loo in time and she wouldn't be able to do it again. She came to see me in tears, aged 83 or whatever she was. She was an elderly lady, and we gave her some medication and we gave her some vaginal estrogen, and she did it again. She collected for the lifeboat, and those are the sort of things that make it worthwhile. And so you always can look for little ways of helping pelvic floor dysfunction, and even if you can't cure it completely, without doubt you can make it better. And that doesn't mean wearing pads. And pads have their place, they do. They are, for some people, they are very important. If you've had sort of a severe stroke or something like that, and you can't get, you're so disabled you can't get through. The quality of the pads that are available now are fantastic, and they work, and they're based on the baby nappy technology, and they are wonderful. And so we do have that need, but most of us really can wear them if we're getting better. If you're wearing a pad, you should be doing something about the reason why you're wearing it, not wearing it. That's
absolutely
my motto.
So I guess, is it the same kind of, in terms of symptoms and what you can do about it if you're, during perimenopause and postmenopause? Is it the same, what you've just said for the pregnancy? Is it pretty much the same?
It is. I mean, the difference at the perimenopause is we're at a different stage of our lives. Your children are largely grown. You're not trying to juggle a million jobs like small children and work and things. You're maybe cutting back a bit on work. You have more time to think about yourself. And it's that huge drop in estrogen at the menopause, which happens to you when you've had a baby, but you get it back again. So at the menopause, you do not get it back again. It's going and gone. And yes, you can take hormone replacement therapy and use the vaginal estrogen, and actually they can make a significant difference. So they give you back some of the estrogen and things that you need for the pelvic floor to give it its elasticity and its ability to contract when you trip on the pavement and you think, oh no, I've wet my pants again. And actually having that increased estrogen can help you at that time. So they are similar, but not. When you're younger, so all your muscles work better. And yes, as I said to you, you can always get better even if you're 83, but it's much easier when you're 30, which is why it's much better to care for the pelvic floor postnatally than it is to start the process at 55. And a lot of my patients who were 55 sent their daughters to me because when they had a baby, they said, I'm going to pay for you to go and see Jane just to have a look and see what you need to do. We all need to do something because without doubt, having a baby, whether it's a cesarean or whether it's vaginal delivery, causes trauma to the poor old pelvic floor.
Yeah.
And so, you know, we both things really are related, but different. So as I say, when you're younger and you're going to get your estrogen back, you're going to recover quicker than you are when you're in the perimenopause.
Yeah. You've mentioned, you know, a couple of things that I can recall right now that you can do to, you know, improve your pelvic floor health, and or perhaps even, you know, completely eliminate the fact that you're leaking and things like that. Okay, so that, you know, physio, you can use weights, and you can use the
biofeedback, and biofeedback, which I love. Biofeedback is one of my favorite tools to do with, I mean, any kind of recovery from anything, really.
Right. Okay.
It's useful because we are creatures that like results. We're a results-driven generation. We think, oh yes, you know, I got 10 out of 10, or I ran that bit quicker, or I did this better, or I, you know, whatever. And the same goes for pelvic floor rehabilitation, because it is kind of boring to sit there, keep contracting your pelvic floor and, you know, remembering to do it enough. You don't really need to do it that much to make a difference. So if you are just doing the exercises, just, you know, that sort of, my advice is to sit on a hardish surface, hard chair or the arm of a chair, with your feet on the ground and sort of leaning slightly forward, and then a sort of squeezing in of the anus as though you're trying to stop passing wind, and at the same time a pulling in of the vaginal muscles as though you were trying to stop peeing mid-flow, and then holding for 5 and letting go. And we do it in a squeeze, lift and hold, and then gently let go. And if you do that 5 times twice a day, followed by 10 little short ones, so squeeze, release, squeeze, release, squeeze, release, because there are different muscle fibers, which we won't go into, that you need to do the long, slow holding and the short, sharp squeezing, both of them. Really can see a step change. And you only need to do that when you're turning your computer on in the morning, turning it off at night, being on the bus on the way to work, driving the kids to school, cleaning your teeth. Although a few patients will tell me, well, I can't clean my teeth and do it at the same time. So it's like patting your head and rubbing your stomach. I can't do it. But, you know, whatever pushes your button, but it's just finding something that is that trigger. And if you can find a trigger, then that's the important thing. I think that is like really important, as I said to you. You know, using the right muscles and doing the exercises often enough.
So I guess, you know, the exercises are very important, and I do know the Squeezy app. I have used it.
That's good.
I have used it. I think it's great, but I am, you know, it's not a habit. It's not built in for me to do it. And
you're not sort of programmed to it.
Yeah, exactly. And I have stopped doing it. So I wanted to know your thoughts, if you've come across all these kind of alternative ways to improve your pelvic health and stop you leaking. I've seen, you know, that some people have got these pills. Some people, you know, you go to a clinic and you can have some kind of, I don't know, you sit on a chair and it does something, and then you're kind of, you're cured almost. I don't know how long, you know, if it's kind of one thing that you do once, or whether it's something you have to do.
A series of treatments.
So what are your thoughts on things like this? I mean, I've seen, you know, all these new developments come through, as opposed to maybe women that, you know, that they are busy, like you say. Now we're working, we're doing, you know, we're caring for the elderly, we're you know, doing all sorts of things all at once, and sometimes the Squeezy app doesn't work because we just can't, you know,
you need to forget. Seek help. And it's, as I said, it's like, you know, going to the dentist or the Pilates class or the yoga class, whatever it is. You know, I mean, certainly for those kind of things, they have some benefits. There's also a pair of shorts that you can wear that stimulate the pelvic floor. So people who don't want to use vaginal devices can wear these shorts that pass the current through the pelvic floor. But really, all of those things, you need to have seen a pelvic health physiotherapist or a pelvic floor specialist. I mean, at these clinics, they will have people like that to discuss it with you first, because there are contraindications to using some of these things. Medication is, again, with the GP, and medication is really only used for the overactive bladder. There is a drug you can take for stress incontinence, but it's actually quite a strong medication and would only really be used for people who were literally had uncontrollable leakage. So always, if you are going to embark on these things, particularly because they're quite expensive as well a lot of the time, is that you go and have a consultation with somebody who understands the world of pelvic floor health, and then you can go down the right path. And I think a one-off consultation sometimes is enough to push you in the right direction, that you are doing the right thing for you. Because there's always going to be gimmicks out there that, and you don't want to spend a lot of money on something that isn't going to work. But in general, simple things are best. So like the biofeedback or the weights or electrical stimulation, but if you're going to do those things, just go and have a consultation. Just one, it really will be worth it, is my advice. And it's very hard to give advice about all the things that are out there, because, if I put in pelvic floor, which I do, as you can imagine, and I'm like, what is that? Some new little piece of kit that's popped up. And so if you've
even natural, there's a lot of stuff out there now, like natural medicine or kind of natural things that are helping women to not leak and things like that.
There are, yes. And I strongly advise anyone who's going to take that sort of thing to read the research and, or ask, a medical professional. Because, it might be very glossy and lovely, but is there enough medical evidence to suggest that this is the right thing to be taking? And I do a little bit of Instagramming, and some of my colleagues, I'm not interested in that. I'm only interested in evidence-based medicine. And some of my colleagues, they rant and rave about, people who are exploiting probably things like menopausal women, creams to stop wrinkles and, all the rest of it. And no doubt for the pelvic floor too. So I very strongly stick to evidence-based medicine. And that's why I suggest seeking help. But if the very least you do is if you're going to take something that you've bought over the counter, read the medical research. It's all there online. You can easily find if there's one very shaky study, or are there, is there lots of evidence and it was done at good places, like teaching hospitals. So I know that's probably, one step too far, but I think if we see something that we think, oh, this was going to help me, and if it works and it helps you, I couldn't be more pleased. I'm not, I'm not anti any sort of treatments, even the most bizarre that I see online and think, oh my God, did that come from? But, if it works for you, because sometimes, particularly if it's the overactive bladder, there is an element of anxiety causes it to happen more, that, it makes you worse. Because you think, oh my God, it's going to happen, and then your anxiety levels rises, and then it is worse. So if whatever it is that you do is helping relieve that, then I'm never against it. And obviously, presumably if they sell it in boots and things like that, it's got a significant amount of medical license. But I still always think, just check out what we're putting in our bodies.
Yeah. Oh yeah, absolutely. I just had a thought when you were speaking about that. I just thought, we some people go to the gym to get stronger, maybe get more muscle mass and things like that, and the pelvic area is a muscle. Correct me if I'm wrong. And if you're taking just a pill to enhance those muscles and make them stronger, it's like me taking a pill instead of going to the gym.
Yes.
Increase my muscle mass on my arms or wherever I want to. And I think, actually, I'm not going to do that. I'm just going to take a pill, and my muscles will all of a sudden grow and get stronger. I don't know whether that's probably going to happen.
It's not that simple, is it?
Yeah. I just had that thought actually just now as we were speaking, thinking actually, my pelvic floor, it is a muscle. And for it to get stronger, it needs some form of exercise.
It does. And, obviously, if you've got reduced estrogen after the menopause, as we've said, and I keep banging on about it because I just feel so strongly, we know that 70% of women, 70% would benefit from vaginal estrogen, and 7% are using it because it just isn't out there. And so if you use that, it will give back a bit of estrogen to the urethra, to the vagina, so it can help elasticity. So I'm going to make your pelvic floor recover, but it will help aid you doing things about making it better.
Right. Okay. And where is that something you can, obviously it's not over the counter, but is that something that if you approach your GP about, they can prescribe it or point you in the right direction?
They can, and it is available over the counter, although you have to buy it over the counter now. It's only relatively recently is it being available over the counter, but it's available through the GP, so you can get it on the prescription. It comes in the form of pessaries, so things that looks a bit like a Tampax, so you push it in and there's a tiny little pellet in the top that you put it in at night and it dissolves overnight, but so by the morning it's dissolved. They're little look like little suppository things. There is cream, so some people prefer the cream. And there are rings that you can, so those of us that keep forgetting to do it, you can wear this little, it's a very small, very soft little ring, and it goes in there and it stays up there for 3 months. And then you change it. The hormone is emitted slowly over a 3-month period. So there's lots of different ways. So it's important that you could go and talk to your GP or the practice nurse, and then they would, which would actually suit you best. Which you were actually going to use it, which would help you the most. It's a really good thing to do. And I'm as a fan.
Yeah, absolutely. I think, obviously the clear conclusion is that if you are leaking or you're having, urgency to go to the toilet, you're feeling any sort of pressure, it is absolutely not normal. And we need to normalize these conversations, that's for sure, because they are quite taboo. And if all the women that are experiencing, a lot of women who are experiencing any of these things, put their hand up and said, yes, I leak when I jump, I leak when in these situations. And I am absolutely one of them. I leak when I'm in certain situations, and it is a horrible thing. But now I've been quite open about it with my kids, with my husband. I'm leaking right now, and I need to go and sort it out because I want to make it a normal thing within my household.
Good for you.
And I just think the more we talk, and I know it's not, appropriate or nice for everyone to talk about it, but at least definitely there is help out there. Go to your GP, go and get the help you need. And if you can't even do that, you've got the Squeezy app.
That's it. There are so many things out there than we have. I'd be careful of Dr. Google because, we can find all sorts of quackerism on there. But, if that is happening to you, just go and talk to the practice nurse or the GP, or go to see a women's health physio or a continence nurse specialist. Just don't suffer in silence. And most of the time you can cure the problem. And if you can't cure it, you can absolutely manage it better, like my lovely lady who was doing the lifeboat book.
Yeah, that's an amazing story. 83 years old. That's fantastic.
There you are. See, if you can do that, you can do anything.
Yeah. So there is hope for me.
There's hope for us all, for sure. Love your pelvic floor is always my sort of mantra, I think.
Yeah.
You don't absolutely. Love the pelvic floor enough.
Jane, thank you so much. You have provided so much information, way more information than I thought that, we were going to go through. But we've been through a lot here. And I hope, anyone listening, any woman that's listening, just even if they understand that actually this is not normal at all under any circumstance, and I need to go and speak to someone about it, whether it's your friends, your family, your GP, and you do and just take that action that you need to take. That's Jane, thank you so much for being on the Empower podcast. It's been great. So much information.
My pleasure. It's always lovely to chat, and I hope it's helped the ladies that are listening and men too.
Yeah, absolutely. And of course, all the information on you and your book will be in the show notes. So
Thank you.
again, the book is a starting point for information as well, if you want to read that. But anyway, I shall leave it there. Thank you so much, Jane.
My pleasure. My pleasure.
Thanks for tuning in to Empower Her. I hope today's episode has left you feeling inspired and motivated to make a positive difference in your world. Please follow the podcast and share it with anyone who will find it helpful. Until next time, keep striving for positive change and greatness for all women.